Sophie Walsh.
Good afternoon. Another record-breaking day of case numbers in New South Wales. 23,131 infections overnight and sadly 2 deaths. Testing clinics have been inundated once again, with some centres shut down, putting more strain on the system. An additional 140 COVID patients are now in hospital, bringing the total to 1,344. 105 people are in intensive care. Victoria's testing system is buckling, with 54 testing clinics closing, unable to cope with the record 60% surge in COVID infections. As Emily Rice reports, it comes on another day of record-breaking case numbers for the state.
The queues are getting longer across Victoria in response to our deepening COVID crisis. New infections have jumped by more than 5,000 since yesterday, with a record 14,020 new COVID cases and 2 deaths.
We all need to be aware that Omicron is sweeping through our community now in a way that we have not seen in the last 2 years.
The testing system is reaching breaking point, with the COVID commander announcing 54 private testing clinics run by Melbourne Pathology, Foresight, Australian Clinical Labs and Dorevitch are closing for the next few days to deal with a backlog of swabs.
They're doing a pragmatic thing in order to safeguard their system and to make sure the labs can get back on top of their workload.
Those lucky enough to get into the queues at other clinics face hours in the lineup. Then it's taking up to 5 days to get a PCR result.
Frustrating just not knowing, not having the closure of the result.
We've got the ludicrous situation right now that people who have been tested before the new year haven't got their results, and it's now time for them to come out of isolation.
The acting Premier says the health system is coping for now, with 512 people in hospital with COVID.
Importantly, those hospitalisation numbers are remaining stable, and that's a key metric that we're keeping all a very close eye on.
But it's a different story from those on the front line.
It's got worse and worse. We thought it was bad last year when we first started talking about COVID, but this year has been out of this planet. Is just awful.
The fact that many people cannot access home testing kits is skewing the number of real infections in the community.
There are now 48,297 confirmed active cases of COVID in our community, and we suspect, of course, with the growing number of people using the rapid antigen testing platforms, that the actual number will be far higher than that.
The acting Premier, Jacinta Allen, wants to focus on vaccine numbers. Right now, 11% of Victorians have had their 3rd dose.
We know around another 1 million Victorians are eligible for their 3rd dose, and that number will increase when the 3-month change comes into effect.
With Victoria's pandemic problems escalating, there are calls for the Premier to come back to work, and he will return from leave briefly tomorrow for the hastily convened National Cabinet meeting.
Let's go to Peter Fegan in Queensland now, which has also recorded its highest daily case numbers.
Well, no surprises that the case numbers continue to grow here in Queensland. 5,699 new community infections in the last 24 hours. And once again today, we're being told that the worst is yet to come for the Sunshine State. The state's top doctor, Dr. John Gerard, has once again today said that by January, mid-January, the cases here in Queensland will be enormous.
The numbers of cases we are expecting to see through January will be very high, certainly in the hundreds of thousands, if not more, in Queensland.
Now, there was a silver lining to the numbers today, and that was that the hospitalisation rate is still low, with just 170 people in hospital across the state with COVID, 11 of which are in ICU, and just 2 of those patients are on ventilators. Now, believe it or not, the rise in numbers isn't the most pressing issue here in Queensland. It continues to be testing. Testing centres are jammed, with a number of the busiest centres today turning people away. Wait times are in excess of 4 hours, and the fact that some private clinics were closed today hasn't helped.
Our website has shown that private pathologists were to be open today, but we have been advised overnight that in fact a number of private pathologists are not opening at the moment.
The Queensland Government concedes that testing is an issue and is currently discussing a number of options to help ease the burden here in Queensland. One of those options is rapid antigen testing. 500,000 test kits arrived in Brisbane yesterday and will now be dispersed across the state over the next week.
Australia's competition watchdog has announced a crackdown on retailers price gouging rapid antigen tests. Federal politics reporter Rachel Baxter has the details.
The ACCC has launched an investigation into complaints of price gouging after reports that some retailers are selling rapid antigen tests for 3 times the recommended price. The competition watchdog has so far received more than 100 complaints from consumers about excessive prices, with a lack of supply also to blame for the price hikes. ACCC Chairman Rod Sims says consumers should report price gouging behaviour.
The ACCC is obviously acutely aware of the concern over the pricing of rapid antigen tests. We've set up a team to work on this issue. We have the ability to name and shame people if they are doing the wrong thing.
Pressure is also mounting on the government to make the tests free. They are now the preferred option for people without symptoms. But Prime Minister Scott Morrison says, unlike the PCR tests, Australians will have to pay. Speaking from the Central Coast today, Opposition Leader Anthony Albanese said it's a sign the PM has left Australians on their own.
Everyone should have access to a rapid antigen test. It shouldn't be dependent upon your income.
We're making sure that we have more supply coming into Australia over the coming weeks. We expect to see more than 100 million kits sourced for Australians.
The government is considering whether to discount the tests for concession card holders. That will be discussed at tomorrow's National Cabinet meeting.
Theranos founder Elizabeth Holmes is facing a lengthy jail sentence after being found guilty of defrauding investors. The former tech billionaire, whose company falsely promised to revolutionise blood testing with finger prick analysis that could detect hundreds of diseases, was convicted on 4 charges of fraud. She could now face up to 20 years prison for each guilty conviction. Beaches across Queensland's coastline remain closed as ex-tropical cyclone Seth continues to unleash on the country's east coast. Nick Kelly is there.
We were told conditions would ease today, and that is certainly what we're seeing. The swell that's battering the coast is a shadow of what it was yesterday. Still, conditions are quite dangerous in the surf, both here and up north on the Sunshine Coast, with Gold Coast lifeguards closing all beaches today. Still, that hasn't deterred people from ignoring those red beach closed flags and swimming anyway, which is keeping lifeguards quite busy. We've also seen more tidal flooding in low-lying areas, but damage and scarping to beaches hasn't been as bad as expected. Ex-tropical cyclone Seth has weakened significantly over the last 24 hours and is expected to continue to ease.
We are expecting it to continue to weaken as it moves slowly northwest towards the Queensland coast over coming days. There's a lot of uncertainty where ex-tropical cyclone Seth is going to cross the coast over coming days. At this stage, it looks most likely between sort of the northern Sunshine Coast and somewhere down to Brisbane, perhaps.
We're expecting to see showers fall in the southeast as the storm edges its way closer. As for beaches, lifeguards tell me they will reassess the situation tomorrow and perhaps reopen at least a few.
Next on 9's Afternoon News, why health authorities believe we could have passed the peak of the Omicron wave. 9 exclusive, how the NRL is preparing for a COVID-safe season. A very close call for a family in Sydney's West. And we speak to Glenn McGrath on the eve of the pink test.